Clarkston, Georgia is located in DeKalb County. It's 20 minutes northeast of Atlanta, and it's just an area of 1 square mile. It has a population of 12,637 people. It's a very, very diverse square mile because it's actually a refugee settlement. 43% of the residents are foreign born, and in the high school, 47 languages are spoken, and students come from over 54 different countries. The elementary schools were built in the 60s. There is no middle school in Clarkston. The closest middle school is Freedom Middle School in Stone Mountain, and there's a high school. There's also further education institutions, Georgia Technical College and Georgia State University has a Clarkston campus. There are no hospitals in Clarkston, but there are 2 hospitals within 5 miles of the city centre. There are no assisted living facilities in Clarkston, but there are community health centres in Clarkston. The Clarkston Community Health Centre and the Ethne Health Clinic. These clinics have mental services available. Clarkston does not have a fire department, but Clarkston does have a police department. It has many churches and a few mosques, a few parks, and there is a train station that goes through Clarkston called Avondale, and there's also many bus stops, MARTA bus stops at Clarkston.
In assessing a community for public health intervention, the social and physical environmental determinants of health are important to consider for possible impacts on the health of the community. Social factors relevant to the health of the Clarkston population include safety and violence, organization and access to health care, community connectedness, intra-community communication, language differences, and social capital. The city of Clarkston rates slightly above the national and state averages for various crimes. This can lead to feelings of disconnection and distrust amongst neighbors in the community. The majority of the population in Clarkston is made up of ethnic minorities, many of whom are immigrants or refugees. These groups are particularly vulnerable to health issues and disparities. Immigrants to the United States are not eligible for any public health care services for the first 5 years after relocation. These populations are also less likely to have health insurance, and they are more likely to lack the tools to advocate for their own health needs. The diversity of languages spoken in Clarkston provide for another challenge with regard to communication. This adds to the issue of health literacy in the community. Environmental factors that are relevant in Clarkston include a lack of access to quality healthy foods and a possible negative impact on air quality due to the community's proximity to major highways and interstates in the Atlanta area.
Behavioral health is a critical and often overlooked component of a successful population health management program. Many people suffer from both physical and a mental health or substance abuse condition, yet our healthcare system and available resources fails to integrate mental health care with other medical services. Refugees especially face unique and complex challenges related to their mental health and are often at greater risk for developing a mental health problem. Due to overwhelming circumstances and experiences, many people of the refugee community suffer from anxiety, depression, and post-traumatic stress disorders. Their psychological state often deteriorates due to many factors, including separation from family, fear, language and cultural barriers, associated stigmas, as well as poor access to medical care. Human devastation syndrome is something greater than PTSD, and affects many refugees deeply impacted by the horrors of war and loss. Unfortunately, most refugees do not receive needed mental health care to address these issues. There are many challenges in the detection and effective treatment of mental health problems in refugees. Often, barriers and pre-existing biases can hinder delivery and availability of behavioral health services necessary for promoting the physical, mental, and social well-being of the refugee community. In Clarkston, there are no specialty clinics that focus primarily on mental health services. However, there is the Clarkston Community Health Center and other health clinics that offer some specialty services, including um, free medication, free psychiatrist consults, and home visits. For the refugees of Clarkston, one concept that is helping with mental health well-being and supporting the community is the Refuge Coffee Company. Much work still remains to be done to develop culturally competent means of screening and assessing for mental health issues and implementing evidence-based interventions both for the individuals and the community of Clarkston.
The priority need identified within the community is the need for mental health care. Clarkston is a refugee settlement city and very diverse, so we've chosen to focus on the refugee population as they have higher rates of mental health disorders. Many of the refugees do not seek the help or get the help that they need, whether due to communication differences or stigma that differs culturally. There are clinics already established within the community that do offer mental health services. However, there is a need more geared towards reaching out to the refugee community. We plan to collaborate with the already existing community clinics such as Ethnic Clinic and Clarkston Community Clinic, where they already offer mental health services. We would like to specifically target the refugee community by screening for the prevalent mental disorders within their population, such as post-traumatic stress, anxiety, and depression among the adult and youth population. We also would like to work with the community businesses that are already established and geared towards providing a safe place for the refugee community, such as the Refuge Coffee Company. Because the majority of the refugee community does not have English as their primary language, it is important to provide various resources educating on the importance of mental health within the refugee community in the languages from the various countries that these refugees have sought asylum from. We also hope to reduce risks for other chronic diseases such as heart disease by improving the overall mental health of the community. Though it is virtually impossible to reduce the risk of developing mental disorders within the refugee community, we plan to identify those who may be struggling with mental disorders and provide the necessary resources to get them into a better mental health state.
When it comes to evaluating our proposed intervention, we do so with the understanding that it is essential to establish a professional relationship with the aggregate, which in our case is the refugee community. We also understand that meeting with the aggregate regularly will allow the community health team to make in-depth assessments of any changes in the mental health status of the participants. And also, evaluation of the intervention, we understand, should include the participants' verbal and written feedback, because after all, the intervention is meant to benefit the participants, and their input will essentially guide the intervention. We will be evaluating the success of our intervention through written surveys as well as discussions at the end of any services provided. Assessments will be performed during visits to the community health center as well as during therapeutic group sessions at Refugee Coffee. The participants will be able to openly express how they feel about the mental health services and what changes they would like to see. Here we have an example of a satisfaction survey similar to what we would provide for the participants. We would obviously customize this survey based on input from the participants and as services changed over time. Finally, any long-term evaluations would be performed by professionals who have worked continuously with the aggregate because they would have the ability to establish a baseline and provide a better understanding of behavioral and mental health status changes that have potentially resulted from our intervention.